name's Aaron Clark. I'm the Head of Digital Solutions for IT Infrastructure and Innovation here at Frimley Health Foundation Trust. I look after the infrastructure. Frimley Health Foundation Trust was formed in 2014. It was made up of two large previous trusts. We cover a very broad, wide-ranging population. Back in 2014, when Frimley Health came together, the two technology stacks were very different. We formed a digital strategy in 2019, which was a 3-year strategy that aligned broadly with the Trust's wider strategy, which was one of the key points was around advancing our digital strategy. The main purpose of that digital strategy was to put in firm foundations, and one of those firm foundations was Wi-Fi. Digital strategy, the idea was to update the end user devices, it was to implement a cloud-first policy, move forward with the Wi-Fi and ultimately result in the deployment of a new EPR. So in terms of the way we wanted to approach the Wi-Fi project, it was more than just a rip and replace. So we knew that we didn't have pervasive coverage, there were black spots everywhere, the technology wasn't consistent across the organisation. So we almost started from scratch. We wanted to look for a partner who could take us on that journey. We were going to survey the entire organisation again from scratch to ensure that we had the level of coverage that would support our future strategic objectives. Once we'd engaged with Computacenter initially, we sat down with Computacenter and the internal digital team to look at a set of requirements from both a business and a technical perspective. We drew those together and then went out to the wider market. Key outcomes had to be that it supported our investment in a wider Epic EPR. And we knew for that we need seamless coverage across the whole of the organisation, and that would enable clinicians to treat patients at the point of care. And it's really important, whether it's at the bedside, up a stairwell or on the outskirts of the building, that consultants and clinicians, nurses, etc. had access to the Wi-Fi network. So we had to do full surveys across the whole of the organisation. The reason for those full surveys was to ensure we had the right access points in the right location to give us the density of coverage that we required. That was a key success criteria, key objective to make the project the success that it was. So we had to have an additional investment in network technology to support those additional APs. So one of the key requirements from the migration process was always to be as seamless as possible. We didn't want to be too invasive or impact the clinical workforce or the operational workforce indeed. The fact that the digital strategy was ended when we deployed our EPRs, but the idea about the Wi-Fi project was it would be completed and delivered before we went live with EPR, which indeed it was. The importance of the Wi-Fi being almost a prerequisite for EPR was, once we'd chosen the EPR, being Epic in this case, we'd designed the EPR around Wi-Fi technology. So again, going back to the WOW conversation, we concentrated on deploying a lot more Wi-Fi enabled devices than we would have done normally, or Epic would have done normally indeed. A year in, it's a very different place. The technology out there on a ward now is very different to what it was a year ago or even 4 years ago. The kind of uptake in Wi-Fi overnight from pre-Epic to post go-live Epic was quite significant. It was over 100% overnight, and it's continued to trend upwards ever since then. Clinicians and the consultants have the WOWs, they have access to Epic in a Wi-Fi environment. They have a Wi-Fi specimen printer as well, so that's all utilising the Wi-Fi technology. We also do OBS of the patients, the basic patient OBS, like the temperature, etc., and that's all done via Wi-Fi now as well. So rather than a nurse in the old days writing them down, they now automatically feed into the electronic patient record. Some of the examples of the technologies that we'd like to embrace are things like real-time location services, so we can track devices, potentially track beds, thus saving money. One of the benefits, or key benefits, of the Aruba solution was its ability to self-heal. So by that I mean, if an access point goes down, the density of access points that were within the design, the access points around that area would boost and you wouldn't lose no coverage whatsoever. So that was a key differentiator at the time. A couple of key points in the choice of partner would have been around their ability to be vendor agnostic, because we weren't sure what technology we were going to go for at the time. And also the partner's ability to provide an end-to-end service from design through implementation, through go live support. I think the biggest compliment I could give to Computacenter is, as a partner, which they are now, they align completely with the trust values. They're committed to excellence, they work together, and they face the future. And that was apparent throughout the project.